Hello. Lovely. Welcome to today's webinar. I'll just give it a minute or two while people register and log on and get settled in, and then we'll get started. Wonderful. I can see some people are still trickling in, but I'll just get started with a bit of housekeeping. Welcome today to Biological's webinar in collaboration with Apoha. My name is Robert Nocton, and I'm a key account manager based in the UK. We've been collaborating with Apoha for 2 years now, and we're very excited to have a platform for them to show off their liquid brain technology. Before Shimit gets started, I thought it might be beneficial for us to go through just a little bit about Biological for those of you who are not aware about all the products and services we offer. It's just a short little introduction, and then we'll get started with the actual webinar. Wonderful. So at Biological, we like to think of ourselves as a one-stop reagent and CRO service provider. So how exactly can we say that? Well, at the moment, we offer over 70,000 different products, all made in-house. This includes nearly 50,000 genes, the largest recombinant protein bank in the world, over 14,000 antibodies, and 600 or more ELISA kits, to say the least. This is just our off-the-shelf or catalog products, and if we don't have it, we can make it for you. That's where our CRO services come in handy, or custom services as I refer to them from now on. We're able to come in from drug screening to production and characterization. The whole shebang, you might say. So with a company like this, we do indeed have a global presence. As you might deduce from the name, Sino, we are based in China, but over the past few years, we've expanded our reach globally. We've got our local branch in Europe, based in Frankfurt, with local sales and service team. And we also have production facilities. One recently opened up in Texas for the Center of Bioprocessing for all our American customers. And we also have we've recently acquired a company, Signal Chem Biotech, a world leader in kinases based in Canada. So when it comes to proteins, what exactly do we offer? I mean, 9,000 is a huge amount. So just to give you a sample of what we do, we currently have over 30 membrane proteins. These are isolated from our VLP, nanodisk, and detergent-based platforms. Over 1,000 different cytokines, from GMP grade to basic, and also 1,500 plus drug targets. We also have over 100 FC receptors and the world's largest viral protein bank. So on the other hand, we have over 14,000 antibodies, and you'll be pleased to hear that we validate each antibody for each of the applications it's used in. Need some customization? No problem. We can add, remove a tag, add a fluorophore, or even do some mutations, whatever your needs might be. With the catalog products out of the way, I'd like to speak a little bit about the CRO services or custom services. We offer over 10 at the moment and are expanding our options every year. Of course, recombinant protein and recombinant antibody production services are our bread and butter. If you don't have a sequence of an antibody you want to produce, you can simply let us know the antigen, where we'll immunize the animal and we'll actually develop the antibody for you. If you've got an antibody that you need some manipulation, we've got antibody engineering services, where we can use our platform like the AI-mediated affinity maturation. Other services I'd like to highlight for you today is our high throughput antibody production. What we're able to do is able to produce over 1,000 different antibodies per project. And the lead time is as little as 2 weeks. Even with such a short lead time, we're able to guarantee over 95% purity and an extremely low endotoxin of less than 1 EU per meg. This is important here because this is one of the services that Apoha used for the development of their technology. What's proved really popular in the past few months is our cell-free system. This allows us to produce proteins instead of days and actually in hours. So we're able to send a protein to you in very little time, depending on your needs. So if we're able to produce these antibodies, we must be able to do them in a lot of different sizes, shapes, and sizes. That's definitely the case. We can go small scale from milligrams all the way up to gram, and we're able to produce different sizes or shapes like antibody fragments. We're also able to do fucosylation, for example. So we've got a whole customization available. When it comes to development of antibodies, this is an example of the three different platforms we have for our monoclonal antibodies. We have hybridoma, phage display, and single B cell. What we do is we have a service where we discuss with you, you understand your needs to find the best platform for both your project and your budget. Just a little bit about our recently acquired company, Signal Chem Biotech. It was founded over 20 years ago, and this is the company that's based in Vancouver. They specialize in active kinases and enzymes, and at the moment, in their catalog, they have over 90% of the kinome covered. This includes 1,100 different kinases. And the best part, if you need a new enzyme made, they've got custom services available as well. So, why Sinobiological? Well, when it comes to proteins, we have the largest recombinant protein bank in the world. When it comes to antibodies, over 14,000 are available, and we're able to produce an antibody for you in as little as 2 weeks. And finally, everything we do is made in-house. We offer many different forms of QC depending on your needs, and we have a global presence being around for over 17 years. Thank you very much. With the little presentation about Sinobiological out of the way, I'll just do some more housekeeping for those who have joined us in the meantime. My name is Robert Nocton, and I'm a key account manager based in the UK for Sinobiological. Today we have Dr. Shamit Shrivastava, the co-founder and CEO of Apoha, who will be presenting about their technology. What we can do is there should be a little Q&A box. So please do, if you think of questions, pop them in there. And after Schmidt's presentation, we'll answer your questions. With that, I'll pass it over to Schmidt. Thank you very much.
Thanks, Robert. And yeah, very excited to be here. Let me just share my screen again, and then I should get talking. Well, does it look good, Robert? Can you see the?
Yeah, beautiful.
Yeah, awesome. So yeah, I think I should just get going. Hello everyone, wherever you are tuning in from, whether it's 9 a.m. coffee or a 9 p.m. chai, welcome. I'm Shamit, CEO and co-founder of Apoha, and today we are going to talk about what happens when a puddle start acting smart. We call this puddle the liquid brain, and the answer to what that is lives in two parts. Philosophically, it's our attempt to explore how a simple liquid, like a primordial soup, if you may, might evolve the ability to sense and compute as it's exposed to increasing complexity. But today's story is practical. I will show you how this evolving liquid brain helps predict the behavior of biologics, especially antibodies, with high precision from minimal sample. So keep both these layers in mind. I mean, the deep curiosity that drives us and the tangible results we are delivering. I've been on this journey for more than a decade. Where I was working on groundings of biophysical models in neuroscience, particularly that of the famous Hodgkin and Huxley model. And through this journey, what we learned was that waves in neurons actually have a lot in common with waves on a surface of a complex liquid. The work was built upon the foundation of the so-called state to function paradigm that in a way started with the 1962 Nobel in chemistry and which led to our discovery of a new physical phenomena, that of a nonlinear Lucasian wave that can make liquids excitable. And today we are going to see how this fundamental discovery at the intersection of biophysics, neuroscience, computing is opening opportunities in biophysical understanding of proteins and antibodies in particular. So, what is it that we are aiming to do differently when it comes to predicting behavior of proteins? Well, we are pushing the limits of how many tokens of biophysical information can be extracted from a given amount of material. So, I mean, as I think we all understand that understanding proteins requires high quality and large quantity of data. And particularly the way we are solving this problem today is the idea is that you collect snapshots of this information, properties information from various assays, sensors, instruments. And the idea is to take these simple readouts and collect the picture, combine the picture to build something more complex, which is the behavior of the protein. And I think in an analogy, this kind of goes something like this, essentially, how we have kind of completed this journey now where we at some point we were trying to capture motion of, let's say, a horse through various snapshots taken as kind of a stop motion to create a flip book through which you can understand the motion. And now we are at a stage where, Sora can look through millions of images and generate videos with incredible cinematic beauty. And you can imagine that you can create these beautiful videos, generate these beautiful videos using AI today, because we have invested a lot in memory, compute, better cameras. But I think if you look at this video closely, you will see or you find something very uncanny. If you look at the front two legs of the hopping horse and compare them with the hind legs, you will see you'll realize that a horse would actually never run like this. It's physically impossible. And that's the challenge, which is in general the challenge of AI these days. How do you kind of build models that are grounded in the physical reality and not are not breaking laws of physics when you put them together? And you can imagine it's so much more important for a problem like predicting the behavior of protein, because ultimately, while in this video, in this analogy, you are kind of seeing the disconnect in the frames, in the space and time of how the video evolves, because the model doesn't know how to connect the frames and how to sequence the frames properly. The problem is not very different for biophysics as well, because properties are not static either. They evolve together under strong constraints of thermodynamics. For example, when a system undergoes stresses or is stimulated, so it is not just the properties that we need to measure, but also the contextual layer that connects them is also important, basically. So how do we get all this information? Well, uh, fortunately, the answer lies in an idea we are all familiar with, the idea of thermodynamic state of a system. What this means is that the state data needed to build models for complex system, and by models we can also just think about understanding. So to build the understanding of complex system, we might need large data, but it's still going to be finite. So that's the hope. The challenge, therefore, is not how can we, the challenge is not basically can we actually get this data or is this possible, but rather how can we efficiently and meaningfully gather and process this data with limited time and material that is compatible with industry workflows, for example, or the value chain to actually have any impact on, say, the timelines of or probability of success of a discovery program. And to solve exactly this challenge, we have built something brand new, which is what we call liquid brain. So how do you make a liquid a brain, or basically smart? Well, you start by designing a formulation tuned near a tipping point, a physical state of heightened sensitivity, or so-called phase transition in the material of the formulation itself. Then you titrate your sample into it, but here each droplet doesn't just mix, it excites complex high-dimensional wave patterns, the kind of waves you just talked about. And from creation and collision of interfaces to convection, diffusion, pinching of droplets, rapid exchange of media, basically we make multiple physicochemical processes act simultaneously on the sample as it generates a lot of wave data. These wave responses then form the dynamic state diagrams, trajectories through a rich multidimensional phase space, a thermodynamic state space. And because the system is near a phase transition, because we designed the formulation to be at this tipping point, even small changes in analyte properties lead to large structured shift in these trajectories. That's how the liquid brain senses, encodes, and ultimately computes molecular behavior. So instead of combining information from multiple simple readouts, as we were just talking about, and generate sufficient data and create something complex, we start with something complex and generate sufficient data to deconvolve properties after the fact to generate simple and more accurate insight. So that's the kind of the overall idea here in terms of our approach to the problem. And it's not just a science project anymore. Started the company 4 years ago to actually build towards making this a technology that customers can use, that users can use, can go out everywhere out in the world. And so the full stack solution is now available for use. And here you can see how the data is generated, curated, analyzed, and presented. So how does it work? I mean, practically, how does it work for a user? Basically, we prepare the sample in the relevant buffer at 0.1 mg per mil and place it into the auto sampler that you can see in the middle screen. And from this point, everything is actually automated. We press a button which selects the appropriate workflow for the use case, and the sample plug goes through a UV detector before it is deposited on the liquid brain. Let me just turn on this laser pointer. Yeah. So, so basically, as it's deposited in the liquid brain, which is essentially the formulation we talked about, um, the droplet phenomena is essentially staged inside a language trough, which many of you might be familiar of, but essentially it's a PTFE trough, which houses our special formulation. And second, yeah, and and then essentially the sample handling is provided by the HPLC stack sitting next to the system, which allows programmable sequencing to explore all kind of state diagrams. And finally, the data is continuously sent to cloud, where it is available to be viewed and analyzed on our web UI, but can also be then channeled through the ML pipeline through SageMaker or Hugging Face, which can be made available to anyone interested in even building models on top of our data. So that's the overall stack, and how you can also imagine the user journey going through this, where it's essentially kind of works similar to an HPLC for many of you who might be familiar with, where liquid brain, the phenomena and the device is kind of sitting in the same place where a detector, an HPLC detector would sit. But all of it is, as I explained, comes with an entire infrastructure, which is kind of primed for using these ML-ready embeddings or insights and giving them directly to our users or customers. So, and of course, the particular use case then we are talking about today is early flagging of developability risk, which is something we have been working towards from day one in the company. Why? Because it provides a very well-defined and painful problem that clearly requires high-dimensional, multi-parameter biophysical data as early as possible in the value chain. Whereas you can imagine, early means within the material constraints of the hit identification stage. And therefore, for all that liquid brain can do, the value proposition we are focusing on is liquid brain as a single shot multi-parameter classifier that vastly simplifies optimization. What that means is that you get high precision multi-parameter biophysical insight as early as hit identification from just 10 microgram of material. I mean, that's the key point here, to be able to do that at identification stage. And then fully automated analysis pipeline delivering insights in less than a week for, let's say, a library of, or for example, a screen of 200 antibodies or so. So let's start with then what the liquid brain data fundamentally looks like, and what some of its early features we are able to predict. What you see here on the screen is effectively the lowest level of data sets, the wave data set that the system generates. And as you can see, you basically see two quintessential example of good behaving antibody, trastuzumab, and a bad behaving antibody known as sirukumab. Bad behaving in the sense that it was flagged it had three flags. For many of you who might be familiar with the Jan case study from 2017, sirukumab had three flags, and it's also something that was recommended by one of our customers to be used as a bad control. And what you can see already, if you just look at them as fingerprints, what the liquid brain wave data looks like is essentially a surface profile, and I'll explain how to read into that. But at first glance, you can already see that there are areas where you see clear differences in the fingerprint itself. But the way to read this data is essentially, you can see that on the x-axis, you see time in millisecond. And that's literally the waves coming out of every drop as it's deposited on the surface of the liquid brain. While on the y-axis, what you are seeing is essentially the titration of the sample plug or the liquid as the drops fall drop by drop on the on the system, generating these high dimensional, essentially titration trajectories. And if you think about it, essentially we have multiple scales or time scales present here, and actually we record over 8 orders of magnitude in time scales of dynamic activity at the surface, from microseconds to hundreds of seconds. And you can see that there is a particular time scale window where these differences appear. So there's a lot of data. This is just one of the channels. We have multiple optical channels to measure multiple different wave modes that exist on the surface. But what you can already appreciate is it's not then straightforward to kind of draw insights out of this data. And in order to kind of start on that journey and to kind of make it intuitive today, let's look at one of the earliest features that we have been really having a lot of success with, and that's calculated very simply. What you can do is you can actually project this data on the millisecond time scale to see how, if looking from this direction, how the signal evolves as you add droplets one by one. And if you do that, you actually generate something very simple, maybe also for some people a bit more intuitive, because it starts to look like mass spectra or like typical spectra that many of us are familiar with, familiar working with. But that but the axis is still the time scale of milliseconds. So what this figure is actually telling you, which of the wave features or at what time scale a particular wave feature evolved the most. And what you are seeing here is essentially all the good behaving antibodies, or essentially approved antibodies, and how the signature looks like, this particular signature looks like for these well-behaving antibodies. But now what we can do is we can actually expose or deposit or essentially generate the signature for all the 135 clinical stage antibodies that were also part of the GEN case study. And if you do that, and we just simply color code these spectras, we are not doing any specific computation. The only computational step that we have, I already shared that with you. And so if you do that and you just plot everything on top of each other, you can clearly see that just by eye, you start to see a clear separation in the signatures of high-risk antibodies versus low-risk antibodies. And we are defining risk just on the basis of their status in the pipeline or in the value chain. So in trial antibodies as well as terminated antibodies, you can in general assume that they are high risk, which is also the kind of idea that was presented in the GEN paper. And then approved antibodies, we just color them as green, as low-risk antibodies, and you can see the separation. And remember, this is all, again, just being done by 10 microgram of an antibody, and we generate the signature. And so how do we know if it is, then, how does it compare to other assays? Well, in order to do that, we need to simplify it even a bit further, because a lot of these assays are single point readout. In order to do that, you can again do a very simple mathematical operation to reduce the dimension of this data even further, and you can just integrate the area under the curve. And as you can imagine, this is a highly lossy compression of data. So we are really like taking one perspective on one of the channel of our readout, and now really looking at probably just 0.1% of the information that the system has generated. But already you can start seeing that how this one single feature is performing in terms of identifying high-risk antibodies. And you can see if you basically plot this area under the curve for every antibody that we expose the system to, you can see that the high-risk antibodies start to kind of aggregate or sideline towards the right of the plot, where the area under the curve is higher. And not just that, the other interesting thing to observe is that there is a natural nonlinearity in this response. So certainly there seems to be some sort of threshold, natural threshold. We haven't defined it to be something, but you can see that effectively, as soon as this nonlinear increase starts, we start seeing more and more risky antibodies. So this is also interesting for us. If you inherently find threshold in a system that seems to be, correlated to the final end outcome that you're really interested in, grounded in, the actual outcome of these programs. Now, again, all of this is phenomenology. We're not saying we are claiming to predict termination in trial or approval. We actually did a data-driven study. We exposed the system after designing and tuning it into to be sensitive in a particular way. And then we are just observing the phenomenology of the system. And now it's up to us to decide if we trust it enough to start using it as a predictive tool. And in order to do that, I think like now it makes sense to see like if this was an assay, how would it perform compared to other assays? And luckily, again, the Gen paper from PNAS provides a very nice benchmark, which is kind of, you can also see why such benchmarks are important for the progress of technologies and industry, and has been very useful for us. So if you then essentially do the same thing that many other people are doing in the space in order to prove the accuracy or predictive capability of their models, you can essentially look at the simple classification aspects of your data. So you can do a random forest model using our data sets. And what we did here is essentially we tried to assess the accuracy and precision of these models if they are using let's say Gen 12 assays combined data set to predict the risk, high risk or low risk aspect of an antibody. So that accuracy and precision is kind of shown here by gray color. And then if you do the same thing using liquid brain data, which we just showed, and just one feature, then what kind of accuracy and precision you achieve. And by accuracy, we of course mean, if of all the predictions you make, how many were actually right, whereas precision gives you, of all the things you said were bad, how many really were. Essentially, it tells you how careful your model is when raising a red flag. So you can imagine in the early stages of the discovery program, it's the precision that is very important, because you don't want to say good antibodies as bad antibodies versus being very precise about when you call something out. So in terms of accuracy and precision, Jan data of 12 assays combined versus our single readout kind of gives similar accuracy and precision. And you can also, again, just to remind ourselves, our data is generated just using 10 microgram in a single experiment, single shot, versus you can imagine how much effort it is to generate data from 12 different assays and how much material and time that takes. But what is even more interesting we found was that if you actually combine liquid brain data with the Jan data set, so you can imagine that liquid brain is another assay, and essentially Jan already assessed 12 different assays at 12 data point. You can add just one more data point and you can analyze the performance of 13 assays, essentially combining liquid brain data. And that's marked here in yellow. But then if you actually look at recall value, which is of all the real bad ones out there, how many did we actually catch? You can see again, although Gen or the 12 conventional assays perform in a particular way on their own, around 15% recall, we are around also 12-13% recall. But when you combine the two assays or the two data sets, you actually almost double the recall value. So you're able to pick or identify even more instances of bad antibodies earlier in the pipeline. And this is really interesting, right? Because what this says is that our information is actually quite orthogonal or is very complementary to the 12 assays that are already used. So now if you think about your drug discovery program, and especially if you think about it as a funneling process where you start with a broad funnel and then you screen to narrow and narrow level, at the earlier stages, then if you think about the efficiency of the funneling process of the very first stage, then what all of this means is that if you were able to do 12 conventional assays at the hit identification stage, which you can't because of the material and time, but let's say hypothetically you were able to do that, then effectively the efficiency of the funnel would be similar if you had used, let's say, the readout that we are getting. On top of that, you don't need to change anything in your value chain because essentially the information is complementary. So you can always add liquid brain data, and you can keep doing your assays whenever they are in your pipeline. And then by combining the data that you got early on from the liquid brain, you can essentially always make better decisions. So that's what really comes down, all of this comes down to. And of course, then finally the questions are would be, uh, what all of this, what is exactly liquid brain measuring, and how do we know what properties are in there, what else it can measure. So that basically moves us to the next part. But before that, I would like to kind of add here or plug in that all of this was really possible because of Cyanobiological's help. They helped us express all these antibodies. They worked with a very kind of sometimes chaotic but tight timelines of running these campaigns and expressing antibodies in time, generating a lot of assay data for us as well to kind of validate against the kind of assay values that were reported in Jan papers. So it's been a really fruitful um, collaboration so far. And this is just the start. There are many other data sets in pipeline. We're generating more features, calibrating them with more assay values, all of that in partnership with Cyanobiological. So with that, now if we coming back to the topic of what is it in the data set, what is it that we're exactly measuring? I think there are two ways in scientifically speaking about going about it, right? So there is you can take a data-driven approach where because we have these conventional 12 assay data measured separately, we also have some of our independent assay measurements that we did with Sino. Um, we have this kind of, you can say, metadata for all these antibodies already. And then we have our own particular readout. So you can do a multivariate analysis and see which properties are playing an important role. And so what you can see here is while this is just one of the features that we, kind of extracted in taking one particular perspective at our data, there's a lot more that we need to discover even in this data set. You can see there are multiple properties that are playing an important role from a multivariate data analysis perspective. And the key properties that seem to be significantly driving our readout seem to be charge, cross interaction, and hydrophobicity. So you can see PI playing a role here, which is actually in this case a biophysical attribute calculated computationally, whereas these are assay values. There are also assay values from the Jan data set. And essentially what that means is effectively these are the properties that are playing a role in the various phenomena that we are measuring, which makes sense. I mean, ultimately, most of the measurements are kind of surface interactions. So we were always expecting the hydrophobicity and cross interaction to play a role, especially PI and cross interaction, because I mean, we haven't, from an antibody perspective, what is in the formulation is an arbitrary formulation. So it should not be interacting strongly with them. And if it does, that kind of indicates to charge interaction or cross interactions of some sort. So that's from the data perspective. And of course, as you can imagine, as we have more data, we discover more features. This is the from this perspective, the picture is going to get more granular and more clear. Versus you can also take a hypothesis-driven approach. What that means is you take like a simple model system and you make it go through well-known, well-defined changes in state, because ultimately going back to the first few slides, what we are measuring are state diagrams. So if a protein or a molecule is changing state in a known way based on prior literature, we should be able to observe similar changes. And this is a very well-known example of bovine serum albumin, where you can prepare the protein at different pH values or in different kind of formulations also. And we can essentially generate the risk score or the magnitude that you saw earlier, single point readout. And you can see right around the PI, it goes through a maximum and then drops again. And this is a very well-known behavior. People have studied many different properties that kind of show this similar behavior when you change the pH of BSA. this has been seen as increase in viscosity, increase in hydrophobicity, increase in compressibility. And it's kind of also kind of goes back to this early point, right? Like these properties are intertwined. So when a state changes, many properties changes. And ultimately what this shows is that indeed we are following the state. Which property exactly is playing the most important role is something where you'll have to kind of go back and forth between the data-driven approach we talked about earlier and some sort of hypothesis-driven approach where you can, let's say, specifically modulate a particular property and then see how particular features of our readout changes. So we are working on both these approaches to provide more understanding of what exactly we are measuring. But I think in both these approach, you can see that hydrophobicity clearly sticks out. Like at near pi, we know that due to charge neutralization, molecules are known to be quite surface active. And in the previous slide, we saw that Hick and Gravy both seems to play a strong role or seem to be strong driver of our signal. So then we were naturally curious of running a large data set with one of our customer partners. And we found one who actually have the need to measure hydrophobicity at the earliest stages in their program. And so in this case, they had Hick data and they shared with us 70 odd VHH-Fc antibodies. And again, what you can see is effectively we identified in this case Hick outliers with 85% accuracy when testing for these antibody fragments. And essentially the way it's the similar score that we saw earlier, which is the liquid brain score. But here the red ones are independently confirmed outlier from an Hick assay that our partner ran, our customers ran on their side. These were blind to us. Versus the green ones are essentially which were not which did not have an outlier value. And in the magnitude, you see our readout. And you can see, again, most of the high risk one or red ones are kind of lining up towards the right, towards the high Apoha score. So this again kind of goes into the same validation, this time completely blind, running with the customer, and just all of this again just for 10 microgram of sample. So with that, I think we can have a summary and we can enter the last phase of the talk, which is where this is going. But to summarize, so far, the liquid brain generates high-dimensional, thermally ascertained state diagrams that act as macroscopic ground truths, offering unparalleled data insight into your antibody samples. And by embedding computing directly into the physics of these waves and their dynamics, the liquid brain minimizes material requirements and computational overhead and enables real-time insight. From clinical stage antibodies to early VHH fragments, the liquid brain delivers high predictive power and many times orthogonal or complementary information to conventional assays. And finally, you can actually also build and own a scalable and highly predictive model trained on our data now because of integration with cloud. We are into basically providing this data and selling this data in such cases. And finally, as an experimentalist, you can also, what we are also building towards is enabling backward compatibility across all data, ensuring your programs benefits from historic learning. And this is something, as a experimentalist and biophysicist myself, something I always wanted to have that kind of record or that kind of traceability and tractability of various data sets that I have obtained over a long period of time and how we can kind of plot all of this together and make them still comparable to each other. So this is something, this kind of standardization and robustness is what we have also built into the system to be able to allow that. And then I think like in this, as we kind of go towards the final few slides, basically I would like to kind of take a step back and look at the bigger picture of where all of this is going. So far we have done multiple case studies now, including having shown sensitivity to point mutations when it comes to developability risk. And as a company, we are although building liquid brain not only as a developability assay, but as a biophysical classifier, which is immensely generalizable. So not only we have, various kind of antibody modalities that we can handle, but in fact, going beyond liquid brain is able to be applied to different totally different kind of materials. From food proteins, for example, where our customers have been interested in, looking at uh, finding chicken-like plant proteins, again, like kind of biophysical similarity to get the right texture, to natural oils, lipids, in all kind of solvents and buffers. It's laying the foundation. Essentially, what we are doing is we are laying the foundation of a new kind of computing substrate for in-material computing. And that is instead, the idea is instead of feeding assays data to algorithm, we want algorithms to be running on the assay itself. And we all know, like, I mean, biology is not just about protein, it's about fats, it's about lipid nanoparticles, it's about natural oils and mixtures of lipids and polymers. So we're really building towards being able to handle that entire spectrum of complexity that biology and biological solutions and mixtures present, and then generate this right kind of dimensionality and fidelity in the data that can handle that kind of complexity. So yeah, with that, our offering is already there to at an MVP level. We like to call it unique, actionable, and intuitive data on your fingertips. And yeah, I mean, you can test it yourself in 3 easy steps. Send us your samples today with we need very little. You get these data sets and you get access to UI. And yeah, I mean, we have actually, I'll just quickly go through the roadmap the things that are coming up. We have just scraped the surface of what our data set contains. As we develop more features, our predictions are only going to get better and more precise. Our risk score will capture additional properties, thereby flagging a greater proportion of high-risk leads. And we are also working on mapping extracted features to specific biophysical phenomena. We kind of went over a couple of examples, but there is a lot more there that we are doing. And all of this actually will be published as a preprint in May. So we are full on heads down working towards publishing that paper. So you'll get to know a lot more from a scientific perspective and in mechanism details, what all is happening. And our aim is to basically provide transparent mechanistic explanation for why certain candidates are flagged as risky, enabling better decision making and also at some point regulatory defensibility. We are also constantly working on enriching our data set. That's where, again, our partnership with Sinobio is really being critical. And the really exciting bit we are also working towards, and this is something you'll kind of already see at PEX Boston into the coming in May, where you'll be seeing all these new features, new data sets, but also the in silico platform that we are working. So we are expanding our platform to include best-in-class design models. I mean, that are trained on combined data set from liquid brain data, sequence data, conventional biophysical data, and think about like fast design loops, constantly improving predictive models, and a one-shop stop for all your design, test, and analysis need. So that's what really in the pipeline, and there are many workflows we are working on. So it's not just about non-specific properties, but essentially you can incorporate your target in the liquid brain as well. And we are working towards releasing these binding workflows soon. And then finally, we are working tirelessly to ensure we can get this breakthrough technology to your lab. We are aiming an end of year, for the first wave of deployments to our strategic partners and early adopters. So yeah, Liquid Brain is not just something where you have to send sample. This is the early adoption stage, but we are through this program, we are also kind of gearing up with strategic partner where these first systems will be deployed. So yeah, I think that's mainly what I wanted to talk about today. There's a lot more coming, new data sets, new properties. You should, if you're around at PEX Boston, I would love to meet everyone. Thank you. Thanks, Robert. Happy to take any questions.
Thank you very much, Smith. That was fantastic. Just to let everyone know, there's a little Q&A box if you haven't seen it already. Please feel free to ask any questions you have, and Schmidt will be able to answer. We already have a few questions in the box that I might put forward first. I'll just go through them one by one. I can start off with anyway. A person asks, relation to antibody comparison, proved versus in trial versus terminated. Did or can the liquid brain correctly predict good candidates that were terminated due to clinical performance rather than biophysical behavior?
I mean, I think at this point, as you can imagine, it's not a straightforward answer. If I got it if I got it correctly, I think the question is to be able to distinguish termination that are due to developability issues versus other issues, if that's the question, right? So yeah, I mean, as I said in the when I was presenting that slide, that essentially what we have done here, we have kind of taken a phenomenological view to the data set that has been generated. And essentially, in order to uh, understand at I mean at the level when we have these properties data, you can identify that yes, it's sensitive to properties, but is it actually comparable to the benchmark, for example, that Jan did? We had to make a choice and effectively come up with some kind of framework where uh, you can you can kind of what is the word, identify or specify the performance of an assay like this. And so we took the two risk levels as terminated and not terminated to assess how does this data set works on a binary classification. But to address exactly what are the reasons, I think this is something I discussed with Tushar, Jen as well. It's not an easily available information that what was the exact reason for a termination in many of these cases. So yeah, so I think we have kind of taking this multiple a two-prong approach, a very machine learning driven approach where you kind of define certain flags or certain labels, in this case terminated versus not terminated, and see how you perform there. But simultaneously, you're also showing what are the properties that you are actually measuring. So it's not a black box in that case. I think, yeah, that's the kind of that's where we are kind of right now with the technology.
Fantastic, fantastic. Just to roll on to the next question, would you be able to give a percentage kind of overlap of bad candidates from the 12 assays versus the liquid brain?
Yes.
What efforts are you focusing on to benchmark this technology further?
No, that's a really great question. First of all, yes, that data, I mean, that visual is already available with us. I mean, yeah, whoever asked this question, we would love to continue this discussion further with them. But I think there are many different approaches. First of all, as I said, like so there you can divide these approaches in three categories. There's the data approach, because we have so far the story you saw today is just one of the features. Like we had this whole surface profile and we kind of compress the data this way and then we compress the data this way. And that's just one particular way of how we compress this data. There are many features, when you do machine learning, you want to actually look at every feature because different properties are present in different point in time. So there's a lot of data science and data analysis aspect of kind of understanding which properties are where in this data and kind of get confidence behind them. But then there is workflow specific approaches that we are also taking, right? So essentially, I mean, ultimately what the technology really measures is interaction between two liquids. And one of the liquids, which is our liquid brain formulation, is completely programmable from a material perspective. What that allows us is to not only build new assays and new workflows, but also kind of understand the mechanisms by even, including conventional things that are in the conventional assay. So we literally putting BV particles on the surface and see how that signal evolves. So there are workflow-based approaches. There are essentially data analysis-based approaches. And data analysis literally is kind of data-driven. So as we are building more data and more kind of label data, in this case, the labels are the assay values it themselves, we are we are learning more and more about what properties are in the system. And then the workflow side is the BSA kind of
Yeah,
example where you kind of design accordingly. So yeah, I think those are the various ways we are doing it.
fantastic. Thank you. For the next question, I think you might have answered it towards the end, but perhaps you can elaborate slightly. They were just wondering, is the liquid brain formulation applicable to all proteins, or is it designed specifically for antibodies or antibody fragments or other proteins?
So it is actually designed specifically so I mean, in the end, it's a colloidal formulation. And it's designed specifically to entangle with multiple properties because that's what we wanted to capture. And then you can imagine if you have kind of this take a machine learning approach to it, if you have kind of a signature where multiple properties are present, then you can learn and train different weights, etc., to tease them out. So that was the so it's inherently designed to measure multiple properties for antibodies or proteins. But if you have specific properties that you're interested in measuring, then you can tune the lipid, the colloidal suspension to be basically specific to that particular property. So for proteins, yes, I mean, the liquid brain formulation can be changed, but for developability, it doesn't change much. And when I say proteins, I meant like all kind of proteins, even the food proteins we talked about. I think the main way we divide our workflows is not proteins or materials, but rather the solvent in which the material sits. So we have like aqueous workflows, which are proteins and aquously soluble materials, and we have non-aqueous workflow or organic workflows, where, for example, if you have a lipid formulation which dissolves in chloroform or acetone, then that's a different workflow, and for that you have a different liquid brain formulation as well.
Great, thank you. Um, the next question is, how can this data help to improve design? How do you plan to create a feedback loop that exists when we do thermal stability assays or pH stability?
And can you repeat the last part, sorry, Robert?
Yeah, of course. So the full question is, how can this data help to improve design? How do you plan to create a feedback loop that exists when we do thermal stability assays or pH stability?
No, that's a really good question. I think like I've kind of maybe I'll try to go over it quickly. But again, whoever asked this
Yeah.
question, very happy to have a one-on-one conversation on this. But essentially, I mean, like when you're thinking about protein design, you're essentially thinking about going from a sequence to a, some sort of property spider diagram. And at least from a, I mean, I'll try to answer this question from simulation and modeling perspective, but I think in general it will apply to any practice of designing proteins as well. So what happens typically is like you start with sequence and you have kind of, you apply these a molecular theory, a force field through which you can calculate, how that sequence, let's say, would fold, or, how would it form structures, and then how would that ensemble of these distribution of proteins will, um, lead to a kind of macroscopic behavior of this protein ensemble, which is the thermodynamic potential. And from this thermodynamic potential is where you get these state diagrams. And or the properties, the macroscopic properties. So if it's thermal stability, it's kind of a state diagram where you're essentially observing the enthalpy versus temperature profile, and that's where you get thermal stability. And from this you essentially get to your properties profile. This is where this sit. So essentially, what the data set that we are producing is enriching this part of the kind of conceptual pipeline that you have in terms of iterating on protein design. This is where the state diagrams fit, and you can ultimately propagate backwards also to even refine your molecular model. So essentially, if you invert these arrows, apply inversion of Boltzmann principle, and then effectively calculate, your conformation ensemble from experimental data, you can actually get better estimates at the molecular theory that you're applying, or the kind of force fields you're applying. So I think this is, if the idea is where this data fits, this is where it fits, and it can fit in addition to any other assay data that you have. So it's basically, you can think of, if you have two assay values today, you can think of it as two-dimensional vector that you have. And if you have more data, you can increase the length of this vector and essentially learn more broader about your protein parameters.
Cool. Thank you for that, Shmit.
Mhm.
For the next question, it's quite a long one, but please stop
Mhm.
me if it's confusing. Have you tested a set of newly developed antibodies, positive clones, and does the data correlate with the best candidate and worst candidate? In other words, can we use the liquid brain as an indicator in early stage discovery to pre-select the best candidate from a pool of newly developed antibodies?
That's a great question. I think I think our value proposition right now, at least
Mm,
at the current stage, is it's highly precise in telling you the bad candidates, right? I mean, this is like essentially one of the case studies that I showed here, which was, this, where is this data? So this is this was very early stage data of VHFC segments, and effectively, in this case, these were newly developed antibodies, which were in the at the very early stages of the discovery program, just like the first plate expression that you would have. And we use 10 micrograms of this. And in this case, you can see like we are really good at telling what is bad. So that is where the focus of the precision is. Precision is about when you say something, how many times you are accurate. So if we say something is bad, we are very good at it. That doesn't mean we are catching all the bad antibodies. It's the same with even if you combine 12 different assays. This was the previous part. We have also done other case studies where, for a smaller set of antibodies, and again, happy to have a conversation one-on-one where we can go deeper into it, where we were even sensitive for point mutation. But again, this is an in our system, outliers are the bad ones. And it is the outlier where we have precision on, because we can clearly see separating out of the cluster. In the central cluster, where the good, according to our assay, the good antibodies are, there are a lot of bad antibodies as well, because the recall is low. And this is true for Jan, like if you use conventional assays as well. Um, but this is something that, essentially the approach we are taking is that we are focusing on capturing more and more bad antibodies, because it's at least in the beginning, because it's easier to chip away that way, because you are looking for something anomaly from a computational perspective.
Thanks for answering that.
Mhm.
Next question. What does a typical collaboration with the Apoha look like? How does somebody start working with you?
Yeah, so I think it's very simple. I think then it's from that point onwards, it's about conversations and friendship. But effectively, the first stage is you send us samples. And we need very little of that. We can set up a meeting with our commercial team that can help you orient through the process, and then effectively we need typically, in order to see the full power of the system, because it works in this clustering mechanisms. It's best to start with like a significantly large screen. Let's say 20 plus molecules, 20 to 50, even 100. Better, more the better. And then we basically receive these samples today, we run them, we provide you access to a dashboard where you can see the results as they are getting populated. And then effectively that allows you to figure out, maybe find your own interesting features or insights as well. But we do provide a ready to use this Apoha score, where the magnitude directly tells you a certain amount of risk that is associated with the antibody. We can also map them against, the conventional data sets that we have, or the standard antibody data sets if we have. And then from that point onwards, essentially we can work on in various different ways. Happy to have a longer conversation around that.
Wonderful. I'm just conscious that we're about to hit 7 p.m. So we're going to stick on for maybe 5 or 10 more minutes because we've got a few more questions to answer, guys.
Yeah.
So don't worry, we won't leave you just yet. Next question is what properties can be measured if the sample is a liposome?
Oh, that's a great question. So we have different workflows. We can measure liposomes, and in that case, effectively, what we are So I think the simpler answer is, because we are providing applying different kind of stresses on the system, what you end up getting is kind of an exchange between the liposome and the surrounding. And what ends up measuring is kind of stability of the liposome. For example, for surface stresses, you can, depending on what you're interested in, pKa of the surface pKa of the liposome is something that we can also measure. Critical methylation concentration is something we can measure. I mean, if you are interested in liposome, you might be familiar with Langmuir-Trough, and anything that you can measure there, we can measure that with much higher fidelity and much richer data sets, and much faster in automated manner. So liposomes are actually very interesting for us to measure. You can even measure just the formulation before making liposomes, and there are strong correlations between what you measure in just the formulation, for example, as a formulation that you spread on the surface as a monolayer, and measure its properties and how they relate to the liposomal properties. So yeah, that's a very rich area of research for us as well.
So in essence, there's a huge amount of things you can do with a liposome.
Exactly. And we are working with we have a program ongoing, which is funded by Germany and UK government, with a company in Germany called Athris. And effectively what we are working towards there, which is, I mean, it's not liposome, this is a lipid nanoparticle, but I think the kind of information I was sharing is basically what we have learned from lipid nanoparticles. And they are effectively are looking for finding correlation between the in vitro measurements, which is our measurement, to in vivo measurements like biodistribution and things like that. And unlike the developability space, I think in lipid nanoparticle, there's not that benchmark yet. So, but I think the hypothesis is valid that biophysical properties are going to be important there as well. So that's what we're working on.
Lovely. Next question is asking, do you offer annotated data sets for training or benchmarking internal predictive models?
Yes, absolutely. I mean, that's where we really want to enable, yeah, I mean, academics, industry partners, startups. I mean, you can talk to
Mhm.
us. We provide annotated data that we can collaborate to help you build that. So absolutely yes. And I mean, we have a really good data set and a case study available on Hugging Face, where it comes with, like, the vibe vector. Sorry, the Apoha vectors. We internally call them vibe vectors, but Apoha vectors that you saw in one of the previous slides, but also our own internal BVP and Hick assay values, which are the conventional values that run together with it. So yeah, answer is yes.
Great, great. Um, just let me know if I'm repeating some questions here because there's a
Yes.
lot to go through.
Yeah.
And you may have answered them already.
Yeah.
Lovely. So I think you've answered this one. I just don't want to leave the person out.
Mm.
What's next for Liquid Brain? Are there plans to extend coverage beyond antibodies? You've kind of gone through that already, haven't you?
Yeah, I mean, basically lipid nanoparticles, AAV capsids. So these are the things we are looking at. I mean, any
Hmm.
painful problem where you think multi-parameter biophysical characterization can be helpful, we are very interested to hear from you. Yeah.
And then we have, how does your platform differentiate between similar candidates? For example, point mutations or closely related isoforms?
I think the main thing is essentially what we measure are macroscopic properties, right? So the properties that are important in liquid-liquid interaction. And liquid-liquid interaction is not simple, as I talked about earlier. There's a lot that is happening. There's a rapid exchange of media when your sample goes from a droplet media to the liquid brain media. There's a sudden change in milliseconds time scale of the ionic environment and all those things. The droplets, when they're bouncing, pinching, there's a lot of dynamic tension and elongational forces being applied on the material. So I think uh, if the point mutation is causing a significant change in biophysical properties, so I think that's the point. I think the hypothesis is if the biophysical properties are important, a point mutation would be relevant if it is changing some of the any biophysical property that we are sensitive to. And so that's the mechanism through which we sense these point mutations. And whenever, at least in one program where they were relevant, we were able to exactly with 90% accuracy find out the outlier or bad molecules, which were differing only by single 1 or 2 point mutations in the antibodies. So yeah, I think like that's the basic mechanism. And then essentially, if there is a particular hypothesis around a specific interaction you think might be relevant, then we can always, depending on the pain, we can design a more extensive workflow. And finally, especially if it's a later stage problem. So we were talking today about the hit identification. So this is not an artificial, but is a value chain
Mm.
determined constraint that we have to do all of this in 10 microgram. But if you have more material, basically you can generate richer and richer and richer data set. Ultimately, thermodynamics says if two materials have same state diagram, then they are same. If they have different state diagram, they have to be different. So essentially, you have to find the location in the state diagram where they differ, and then you can go to almost infinite granularity, if possible. Material is the cost. Yeah.
Okay, okay. So I guess one of the last questions we have here is, can you walk us through how liquid brain detects key properties like hydrophobicity or charge?
I think this we kind of
We
covered a
went
few
through,
times.
yeah. So
Yeah,
don't
yeah,
need to
yeah.
elaborate on that. Perfect.
Yeah. I think just a
Um,
quick answer, hydrophobicity is because we have a lot of surfaces, so so they are sensitive, and charge because we have a sudden change in ionic environment, we are sensitive to that.
Great. And then we have, will it be possible to just send sequences to Apoha?
Yes, and that's where cyanobiology, biology as biologicals also come together with us. So yes,
Mhm.
you can send sequences directly to us, and we can get them expressed, even conventionally
Exactly.
analyzed, and while add on the liquid brain insights to it.
Exactly. Thank you very much.
Mhm.
Right, guys, I'm just conscious that we're about 10 minutes over and I don't want to keep everyone. If you want to just pop up your slide there with, I think it was hello@apoha.com,
Oh yes, I'll do that.
and I will pop in my email as well. Of course, this will be recorded, so if you want to rewatch it or your colleagues have missed anything, it'll be posted on the Sign Up Biological website in the coming days and possibly our YouTube as well. Please do reach out to our partners here, Apoha. I think you can visit them at apoha.com. Will that be correct?
Yeah,
That's their
yeah,
website.
exactly.
And also, if you can take a look at sinobiological.com as well. We have the email there, hello@apoha.com for Schmidt and the gang. And of course, mine is in the group chat. It is Robert_Nocton at sinobiologicaluk.com. Or simply reach out to our website and they'll refer you to the correct person for the correct territory. I think that is everything. So, well, thank you very much, everyone, for coming today. Whether you're sipping coffee in America or chai in India, as Shamit said, and we wish you a fantastic weekend ahead. Thank you so much for sitting down with us and looking to see how this collaboration has become so fruitful. And it's just brilliant to see the strength from strength that Apoha has gone in the past 2 years, and I'm sure 2 years more.
Thank you. Yeah, thank you, everyone. Thanks so much.
Right. We'll say goodbye. So, thank you.